Good afternoon, everyone. My name is Mike Steele. I have the privilege today to represent the Leg Club industry partners. It was referenced earlier about how commercial industry could potentially help more in this particular area. So this is an example of where we work together on that front. For those of you who are not aware, the Lindsay Leg Club is a charity that was founded back in 1995 by Professor Ellie Lindsay OBE. She's personally funded today because she's so passionate about improving the healthcare of lower limb legs. There are over 15,000 members of the Leg Club. Now, that may sound a lot, but actually not when you consider, and the numbers were referenced earlier, 3.8 million patients with wounds. Now, that's costing £8.3 billion. So both those numbers should make a big difference to people. It's also worth remembering that, in fact, in the manifesto, it's got the earlier guest data. So it kind of shows how things have progressively got much worse in a relatively short period of time. Now, the latest guest data of those 3.8 million and $8.3 billion pounds is for 2018. So that's also pre the COVID pandemic. So we know things have gotten much worse than that. Each of us at the Leg Club industry partners work for wound care companies. So we work to a strict code of practice and in how we work together, but also with the charity, patients and NHS. Working in industry, we have specific roles that are useful for the Leg Club. So we have marketing roles, clinical, medical education, training, digital, all roles which help the Leg Club, but also for the benefit of all towards a shared cause. Our objective is to work with a shared purpose that brings value to support the charity, patients, the NHS and our organisations. The Leg Club Industry Partnership is a highly effective alliance between the healthcare industry and the Lindsay Leg Club Foundation. After many successful years, this alliance can be summarised by a simple maxim: empowering patients through a unique collaboration with industry dedicated to lower limb conditions. This is achieved by advocating evidence-based care in a non-medical social environment to Leg Club members, volunteers and communities, raising awareness of preventative care relating to all aspects of lower limb disease, ensuring that all socio-economic groups have given access to well leg management. The LCIP structure enables our corporate partners to be active within the Foundation and Leg Club network. Since our corporate partnership model began, we've been able to develop a collaborative philanthropic approach to educational marketing and effective communication strategies. Activities have ranged from providing educational grants, enabling the Foundation to produce public health information, to industry's active participation in Leg Club conference workshops and the production of an innovative online teaching program available on the Leg Club's website. A clear example of activities are like this one today, in helping to raise the awareness of the burden of lower limb conditions. This needs to ultimately benefit by creating a forum to bring awareness of the size of the problem, which is greater than both diabetes and obesity. Yet it, as we said earlier, is largely unknown outside of the industry, and therefore doesn't receive the much needed focus and resource to treat. As industry partners, we drive and pride ourselves on the solutions that we can provide to help support these patients. However, without the increased awareness and access to treatment to both the problem and variation of care across the country, then our solutions don't get to where they need to be. So raising the awareness of this problem and therefore solutions benefits us all. As previously mentioned, another example of Leg Club LCIP members, activities through the support and production of product agnostic educational materials, such as what is a leg ulcer, so they can have better understanding of what's happening with their legs and how to help manage them. These materials are then accessible by members in print when visiting their local Leg Club, or via other means such as the Leg Club website and social media. In this way, this helps them receive information at a time and place that works best for them, with a consistent, familiar look and feel of information. As industry, we know money needs to be saved, and it can be saved, as highlighted in the Carter Review. However, there is often a focus solely on the monetary aspect of cost, and specifically price, which risks missing the real challenge facing the NHS: how to get better value from the money spent. This means maximising outcomes from activities carried out. Keith talked earlier about outcomes and the focus we need to do on that, while minimising their cost. It means that important resources, including money, time and expertise, should be used efficiently and effectively and not wasted. In fact, in a recent study, it showed an unhealed wound costs 2.5 times more than one that goes on to heal over the course of a year. So, to demonstrate value, work must be evaluated and outcomes measured to demonstrate their impact on service delivery. This includes routine capture of data at the point of care and the analysis to determine which measures work to drive further improvements. The Leg Club model is a great example of this, where it also recognises that some variation in clinical practice is essential to accommodate the individual patient's health needs and choice, and is important in delivering patient-centred care. In summary, the underuse of evidence-based care and overuse of therapies with little or no evidence base does result in delayed healing and costs as a consequence. These costs could potentially be avoided by using consistent evidence-based practice to heal wounds, for which the Leg Club model has been shown to be a good example. The reasons for unwarranted variation are complex, and unfortunately, tight wound budgets and diminishing resources, including time, make transformation of wound care services a tall order for those in charge of service improvement, and therefore other models of care, such as the Leg Club, need to be considered. So as Leg Club industry partners, we are very much invested in shining a light on this hidden problem, as it's a significant problem, as we mentioned, that is largely unknown by most. In fact, I suspect, as mentioned earlier, every one of you here today probably has a close relative or friend, probably elderly, but again, wounds affect all ages, that has a leg condition that hasn't burdened you with the problem, and yet they're in pain and feeling isolated. Some of you may have a Leg Club in your constituencies and may wish to see what work they do. If you would like to find out more, please either visit the Leg Club Foundation website or speak to any of us here today. So in conclusion, it is our wish for today that you leave knowing how serious this healthcare issue is and consider how you can take action to improve lower limb conditions. And as Leg Club industry partners, if there's anything we can do to help you and your constituencies in this area, then please come and ask us. Thank you.